Hi, this is Maggie, and I have asked a professional nurse that I've known for 30 years, who is an executive director of nursing at a large um, governmental agency medical center. And her name is Gail Collier, and she is one of the most experienced, capable managers I have ever met. And so I asked her today if she would be willing to talk to us about strategic planning in a large bureaucracy. And Gail has agreed, and I'm going to let Gail introduce herself to you in terms of her credentials. But let me tell you, this woman has a lot of wisdom. So, Gail?
Well, thank you, Maggie, for that introduction. I'm not sure I deserve that, but it's much appreciated. Just to share with students that I'm a nurse of 37 years. I've worked both in the private sector, and most of my career has been in government agencies. Started out nursing as a baccalaureate with my entry level and progressed through graduate school, attaining my master's degree. Throughout my career, I've held various clinical and administrative roles. I think, with the exception of maternity and surgery, I've crossed paths in virtually every other discipline. I've been in leadership, management type of roles, oh goodness, for the past probably 25 years.
Yeah.
So I'm delighted to be here with you today.
Okay. Great, Gail. So one of the questions I asked Gail was, who do you include and involve in developing the nursing service strategic plan? So let me back up just a minute. The strategic plan is very important to the progression of the organization through change. And so Gail and I both identified the strategic plan as a major concern. So the question again, who do you include and involve in developing the nursing service strategic plan?
Our strategic plan is viewed and utilized as our service's strategic imperatives for the coming fiscal year. Thus, we reach out to all members impacted by the plan, including nursing leadership, nursing education, service committee chairs, and staff. We solicit input and provide the opportunity for all clinical and administrative nursing personnel to participate in the development of our nursing service strategic plan.
Which is an excellent way to go, because this way you get buy-in from all the players in
Yes.
the nursing service.
Yep.
Okay, so how do you encourage and facilitate staff involvement and feedback?
So, securing the staff involvement and feedback is viewed as a priority of our service, and in spite of this priority, it does remain a challenge for us. Our approach has been multifaceted, including presentation and discussions at our service town hall meetings, nurse managers exploring the strategic plan during their unit-based staff meetings. We send and receive electronic communications, and our committee chairs include the strategic planning in their meeting agendas. So we try multiple forums to solicit input and feedback.
Okay. What kinds of issues do you include and target in the strategic plan?
Issues that we include and target in our nursing service strategic plan reflect our core values. As we know, core values define who we are and form the underlying principles we use every day. Our core values include integrity, commitment, advocacy, respect, and excellence. Issues, or more importantly, overarching goals included in our strategic plan include patient-centered or patient-driven initiatives, team-based care, data-driven, evidence-based practice, prevention, population health management, providing value, meeting budget allocations, and continuous improvement. Issues within the larger healthcare arena are also targeted for inclusion in our strategic plan, such as the Institute of Medicine's The Future of Nursing, Leading Change and Advancing Health.
Well, that's quite a list of very important issues and values that you try to include.
Thank you.
Yeah. Can you describe the process you utilize in developing the nursing strategic plan?
Certainly, Maggie. On a quarterly basis, the nursing service reviews our current strategic plan, so it's ever present in how we execute day-to-day business. We look at the successes and barriers, and we constantly evaluate them. In staff meetings and electronic communications, the status of meeting the goals is also shared. So, our first step in developing the strategic plan is reviewing the prior year's plan, what was accomplished and what has yet to be accomplished. Is it still valid? Our medical center is part of a very large bureaucratic organization, thus we review the national and regional strategic plans to ensure we support the overall strategic goals and initiatives. We review our organization's mission and vision to enforce why we exist and what we plan to be in the future. Secondly, we review our medical center strategic plan, focusing in on the initiatives that nursing can support and actively engage in meeting. Lastly, we review feedback obtained from nursing administration and clinical staff for possible inclusion into the service plan. Our service secures a full-day retreat, including representative members from administration and clinical programs to draft our next year's plan. The plan clearly delineates the goals, responsible parties, and target dates of progress and completion. The draft is electronically sent out to all staff for final review, revisions, or concurrence, and the plan is presented in the town hall meeting and available electronically.
You know, it's interesting to me how much it's an ongoing improvement plan that also looks at future issues that are coming up. Do you get a lot of response from the nursing staff when you present these plans, like at the town meetings, and do you get much feedback from them?
The feedback that we look for when the initial plan is put together is, what is important to you in view of your role to incorporate into our service strategic plan. And then the feedback, throughout the year is, specifically if we're not meeting a target or not meeting a goal, what is it that we need to do to revise our approach or activities to be more successful.
So constantly evaluating where you are.
Yeah.
Okay, great. So, in any group planning anything, there's always conflict.
Yes.
Sometimes the conflict's helpful, sometimes it can be destructive, but how it's managed is critical. So, how do you manage conflict in your nursing management group?
Yep. So, to answer this question honestly, I would have to say that our service is committed to embracing conflict.
Wow.
Conflict, if it's managed effectively, is very healthy. We view that as a healthy activity, and it challenges us to see different viewpoints and paradigms. For me, the key to managing conflict is to value and respect each person's opinion and their frame of reference. We strive to openly discuss conflict and to identify the root cause, which are the deviating points and why. We review what the consensus and what is yet to be agreed upon. The areas that are yet to be agreed upon are explored in respect to our goals, our policies, our procedures, and common ground is sought. If there is the inability for us to reach a consensus, as the nurse executive, I have the responsibility to find the next steps and to clarify the expectation and the goal while maintaining that respect in our service.
That is, I hate to use this term, it's used so much, but that's awesome. Okay, when moving from the service level, which you have very clearly described in terms of strategic planning, of course we always have to marry our plans to the greater organization's goals.
Yes.
And so when moving from the service level to the facility strategic plan, how do you see your role?
My role as a senior executive is to advocate for nursing while moving our entire medical center forward. It is critical to have a working knowledge of administrative, clinical, and fiscal services within our medical center. Having the broad picture and perspective is key. At our medical center, each member of the senior executive team serves as a champion to one or more of the medical center strategic initiatives. For example, last year I was a senior executive assigned to the Healthcare Excellence Initiative. I worked with interdisciplinary teams to enhance specialty care such as cardiac cath and neurosurgery, ensure quality patient outcomes and patient satisfaction, performed fiscal reviews of cost by analysis on select specialties, and explored development of programs to increase our medical centers' availability of complex care. Each of the executive team members are intimately involved in the process.
Great, so that it's not an armchair approach, you're in the trenches.
Yes.
Great. So how do you interact with other department heads or other departments or department heads while developing a facility plan?
Well, I would share that I function in a multitude of roles with other departments while developing our facility plan. At times, I'm a champion and mentor to task groups working on strategic initiatives. At times, I'm an interpreter, providing clarity to the teams and employees. I serve as a resource to other departments, identifying contacts to assist them in deliberations or executions of their task. Quite honestly, I fulfill whatever role is needed for our facility to move forward on the strategic plan.
Which is, again, a comment on your ability to work with the team. Yeah. So what strategies do you use to manage conflict at this level? Say there's conflict between leadership in medicine and nursing or something like that.
Well, Maggie, I'd say that how I manage the conflict at this level is probably no different than what I described managing conflict at our service level. As an organization, we do embrace different ideas and opinions as long as they are communicated in a respectful manner. Verbalization of differences enables us to consider different perspectives and what we may have otherwise missed, and to explore opportunities that we might not have identified. At the end of the day, we hold each other accountable to the mission and vision of our organization, and that really is the true north guiding light. That is our key principle, and we hold each other accountable for that.
Yeah, your unifying center. Okay. At what point in the process is the CEO and upper management team involved as a team, and how do you interface with the team in finalizing the plan?
Well, I'm fortunate to work in an organization that the nurse executive is a member of the senior leadership team, which is comprised of the director, associate director, and the chief of staff. As a team, we are involved from start to finish of the strategic plan and are responsible for evaluating progress throughout the year and to make any of the adjustments necessary for success.
That is a wonderful paradigm for nursing to be included in that executive group.
It is.
So what was one of the most difficult issues for nursing that you've had to manage, and what interventions did you use?
I've thought about this, Maggie, and I think, the most challenging and difficult issue is one that probably has been around for a significant part of my career, and that's, assuring that resources reflect and meet what the current demand is. Budgeting for and allocating resources is a fluid process. Projecting utilization need is far from 100%. We don't have a bullseye with that. Our service incorporates all the known factors such as anticipated nursing hours for bed day of care, the utilization of planned and unplanned leave, salaries, awards, turnover, educational needs, the unknown such as supporting new programs or processes that come as a result of national mandates or those that we didn't identify in the strategic plan. It really is my biggest challenge. Interventions that we use include assessing what our current resources are and our ability to reallocate, try to encourage thinking out of the box. We solicit best practices and creative ideas, both internal and external to our organization. We seek new funding streams, to name a few approaches. Maintaining the focus on patient-centered care, patient-driven care, and quality outcomes, has been achieved.
And that's your ultimate outcome.
That is our ultimate outcome.
What do you see as the major challenges of facing your organization in this era?
Well, major challenges facing our organization I don't feel are any different than what faces other healthcare organizations. I believe patient access to timely, affordable, quality care will continue to be our challenge nationally. We cannot pick up a newspaper or professional journal without commentary on the status of healthcare in our nation, the focus being on access and affordability. The paucity of access to affordable primary care, preventative care in our nation is anticipated to grow. As the Institute of Medicine highlighted, nurses are going to have a critical role in the future of healthcare, especially in producing safe, quality care and the coverage for all patients in our healthcare system.
Yeah. I think that is well said and universal right now.
Yes, it is.
What advice would you give our BSN graduates as they move into leadership management roles in today's realities?
So I would say embrace change and be a lifelong learner. Our realities today will look and feel very different tomorrow. Advocate for the removal of scope of practice barriers for nurses. Understand and promote what working up to one's licensure means. Stay informed and become active in legislative initiatives impacting nursing and healthcare in general. Become adept at data management, the collection and the analysis of. And lastly, and most importantly, is pay it forward. Be a mentor and guide and advocate for students or less experienced colleagues.
That's great. That really puts it, that's a wonderful way of putting it. In terms of your organization, when you're hiring nurses, what level of education do you look for?
Well, with the initiatives of expanding the baccalaureate students in your workforce, that certainly is one of the delineating attributes that we look for is the educational level, as well as the experiential level. But baccalaureate means a lot to our medical center, and that is certainly, I think, a very key to success for nursing in the future.
Yeah. Gail, anything else you want to tell our students?
Well, I look forward to you to being what nursing is in our future. Encourage those that are your colleagues or considering healthcare as a profession to step up to the plate and work towards improving healthcare access and affordability within our nation. And I applaud you. Congratulations.
Thank you so much, Gail.
My pleasure.